From the producers of Dr. 90210 comes a revolutionary new look at plastic surgery.
Honey, are you okay? Everything all right? Are you having second thoughts about this?
Kind of.
Oh, baby, we've talked about this a lot now.
I know, it's just plastic surgery. It seems so shallow.
No, it's not shallow.
Chris and Jessica are about to take part in a life-changing experience. They're here for a consultation with leading Beverly Hills plastic surgeon, Dr. James Sue.
Hi guys, how you doing?
How are you, Dr. Sue? Good to see you.
Where's my patient?
He's right here.
Boy, he's growing like a weed.
Oh, he sure has. Maybe a little too much. He's starting to look a little chunky to us.
Well, that's why you're here.
Dr. 90210, Baby Edition.
Come with me, let's take care of that.
Oh, that's
Great.
thank you.
Let's go back.
Yeah.
Okay guys, as we discussed, Tucker's a little bit overweight for his age, so that makes him a good candidate for liposuction.
See, honey, I told you. Yeah, of course he is.
Now, is there anything else you folks wanted to have done while we were here?
Actually, there is, Doc. If you take a look at his chin, you'll see that he doesn't really have one. It's just like a ball of flesh and blubber. Is there anything we can do about that?
Yeah. Now, I see what you're talking about. There's a bit of underdevelopment, hypoplasia in the submental area that leads to some disproportion with the facial symmetry.
I told you, honey. I told you that.
Yeah.
So I think that we can put a little silicone implant right here, build up the surrounding tissue. We don't want to turn him into Jay Leno, but we can certainly keep a little cleft in the chin and keep the Kirk Douglas in him.
I don't know. It just
please. I mean, this is his life.
Okay, fine. You win.
You better believe I win. I think Jess is just scared because I just don't think she understands. It's she doesn't think the baby wants this because the baby can't talk and it's just not true. The babies speak with their eyes and his eyes are screaming at me sometimes. They're screaming like, I want to be handsome. And I'm gonna make him handsome. I'm gonna make him the most handsome kid on this playground. That's my goal.
How do I feel about Tucker surgery? I feel okay about it. Chris has done a lot of research and Dr. Sue's the best, but I think I read somewhere that babies need fat to keep them warm.
Hey, how are we doing? Big day.
Big day.
Today's a big day. Well, listen, let's get started. Let's get everything mapped out. You see these folds here? They're so unsightly. Well, we're going to bring them out. We're going to remove them as we do the liposuction on both sides. We're going to get a little bit there. Now we're going to be left with a little bit of extra fat. And we're going to take this fat and we're going to fill out his cheeks here. We're going to inject here and then we're going to get extra cheeks. And we'll also fill out the chin and we're going to get that Kirk Douglas look right here. And we talked about doing the tummy tuck and the liposuction. So we wind up with those great abs right here.
Six-pack!
That's right, six-pack.
All right.
To recap, Tucker's problem areas are chubby cheeks, a recessed chin, no definition in the abdominals, and unsightly thighs. Tucker's now ready to go under the knife.
Since the surgery, some mothers stare, but I don't care. Tucker looks so mature now. And when I look at their babies, all I see are these giant flesh blobs. I mean, why would you let your baby go like that? It's disgusting.
Dr. Sue is a genius. Tucker, his body has transformed. He went in a baby and he came out like a man baby.
The results are nothing short of spectacular. The before and the after. Notice the toned arms, the defined chest, the chiseled jaw, and Dr. Sue's patented Kirk Douglas chin.
People ask me all the time, how do you know a baby wants plastic surgery? And I'll ask, how do you know he doesn't?
Dr. 90210, Baby Edition.